And in this case, you see the population was about 350 students. 72% of them got this correct. The majority of students in both the high and lower performing groups went for the key correct answer of C, but then a big proportion in both groups also went for answer D.
I guess I'll out myself. I was one of the people who had chosen D even after choosing cell mediated when I typed it. And that was because I started to think about like the bacterial side of things. So I was thinking it's bacterial, so it has to be humoral, and so not C. But then I understand why it is, especially if it's intracellular, because that would be more cell mediated. But yeah, we would treat it then with doxycycline. They were like a tetracycline, which can go into the cell more, like penetrate into the cell more. And so I think that kind of answers your question, but I was missing the fact about it being intracellular, which is I think the biggest reason why I would have chosen the wrong answer on that one.
The fact that it is an intracellular pathogen is actually it's very good that you recognize that about this illness, but it is actually not a fact that is necessarily needed to answer the question. Fundamentally, what the item writer was getting at is, why do patients with advanced HIV have difficulty clearing opportunistic infections? And this is due to a deficiency of CD4. What other antibacterial agent might be part of the regimen for Bartonella?
I think that it was a very interesting question because of the fact that the actual question was not what I was expecting when I first read it. And also getting it down to the humoral versus cell-mediated or adaptive immunity, and deciding between those two was very sticky for me. And then when Dr. Norrie kind of described it as, we're looking at what's happening with the patient status, like not what the microbe can do to you, but like how you're able to respond. Like it made me think about it in a different way.
In the beginning, when we kicked off this question, several of you had mentioned Pasteurella. So one important teaching point I want to bring up there is that both are found in cats, in kittens to be precise. Kittens are actually more infectious than adult cats, but Pasteurella can happen in any kind of host. I've seen patients who've had a cat bite or a dog bite and be perfectly normal hosts and still get a pretty raging cellulitis. However, this infection clearly is very dependent on the severe lymphopenia of the host. And so that's kind of the distinction there.